Hello, everyone. My name is Tyler Whipkey. I'm the Director of Mission and Spiritual Care at CHI St. Luke's Health in the Woodlands. And welcome to the very first, right out of the gate episode of Conversations for the Common Good. And I'm joined today by...
Hello, so I am Raquel Webb, and I'm Manager of Spiritual Care for our CHI St. Joseph Market, which serves our Brazos Valley, and I'm very happy to be here.
All right. So this is the first time that you have seen us. You've seen this series. This is the first time we're ever doing this, and it's Conversations for the Common Good. And the whole thought behind this is that we know that in the midst of COVID and life in general, that there's a lot going on right now. And the thought and the goal is to be able to offer up some timely and meaningful and practical topics that you can take and use in your professional lives, in your personal lives, to just help make life a little bit better and more bearable for you. So, Raquel, in your work as a mission leader and as a chaplain, I'm just wondering, what are you hearing the most, and what are you being asked to help people the most with right now? Any topics or thoughts that come to mind?
Absolutely. So, what I hear a lot is, how do I make it through the day? And what coping mechanisms can you teach me to help me make it through the day? So, it's revolving around our resilience and our well being. Those are the topics that surface. And it makes sense. And I think that's the reason why we're beginning this series. I think that our primary task in this group, right? We work in healthcare, we're helping professionals. It's the physical well being of the people we serve. For you and for me, Tyler, it's also their spiritual and their emotional well being. And I think I would say that we all like working in healthcare, that we feel called to it. And it's a rewarding career, it's a rewarding life that we lived. But on the other side of that, there's being in this increasingly stressful environment that we're working in. The long hours, the heavy caseloads, sometimes with not enough resources, dwindling resources. Some of our coworkers may be negative around us, and we have to balance all of that with our own families, with our significant others, with our children, sometimes aging parents. And I can tell you that in my life, there's this theme of exhaustion. And I'm going to invite you, Tyler, and everybody listening into a little bit of vulnerability here, because I think that everyone's reality right now is that we're working in overtime, or what my mentor just recently referred to as overdrive, okay? So healthcare was stressful before this COVID crisis, but now everything is a little bit elevated. And to me, it seems like everything is a little bit more. Doing your job, treating your patients is more right now than it used to be. Even buying groceries is more right now. Every single thing that we're doing has this heightened effect because of this emotionally charged world that we're living in. We're deeply affected by all of it, though we don't always realize until we have what I'm going to call this physical and emotional collapse. And I think that's the reason why we need these episodes. We want to respond to these things that we assess are happening within all of us.
So I want to pick up on something you just mentioned, the physical and emotional collapse. Help me understand the difference and the nuance of those terms as compared to or contrasted with maybe just feelings of stress or being burned out.
Sure. So there's some important terms that we can define. Let's start with burnout, because a lot of people have heard that. And burnout is exactly what it sounds like. I do and I do and I do, and at one point, I'm done. I feel like I'm burned out. And it's not like I don't have enough energy to do it. It's that I've lost the inner motivation to do it. Burnout is not trauma related. It's simply this culminating effect of being constantly stressed by multiple things that are very stressful. And it's a prolonged response. So one thing after the other, and then on top of more. And that leads to this feeling that we might have of, oh, I really can't do it anymore. So that's burnout. And then compassion fatigue might be another one that you have heard, and that's different. It's been described as burnout plus some. So burnout plus trauma. So what we call like a stress injury. And it's emotional and physical burdens that are created when we experience the trauma of helping others who are in distress. And that's what we do in healthcare, right? Everyone that we serve is facing some kind of distress. And compassion fatigue results when we've done that so much that inside of us, we have this reduced ability and even an interest even in being empathic towards those who are suffering. So compassion fatigue, very rightly so, has been described as the cost of caring. So you can see that they're different. They're similar, but they're not the same. And then I want to introduce one more because you mentioned stress. And occupational stress is very concerning right now. And it occurs at work, you know, occupational. And that's when our job requirements really start to exceed sometimes our abilities, sometimes our resources, and then the needs that we have for our job. So you can think about maybe some nurses right now and feeling the occupational stress. And this kind of stress can be absolutely detrimental to our physical, to our psychological well-being. And then all of that might start to affect the safety of our own patients.
So when I think of being stressed, I think of some days I'm less stressed than others. And is there a method or a tool or a way to think about maybe how to gauge the amount of stress that a person is experiencing at any given point in time?
Absolutely. So there's a lot of tools out there, you know, on the web. And one that I have found so helpful for me personally, I was first introduced to it, and we're going to call it the stress continuum. And I heard about it from and Tyler has just begun sharing the screen. I first heard about it when I watched something on the Schwartz Center for Compassionate Healthcare. And I mention it because it has a lot of great resources if you're looking for some. But the stress continuum, which you see on your screen, is an assessment part of the stress first aid model by the National Center of PTSD. I find it extremely helpful. And what I'm going to ask you to do is, as I explain this kind of assessment tool, I want you to think about it as I explain it, and I want you to pick out where you think you are at this very moment today, okay? So we're going to begin at the very left at this green box, and green is the color of ready, okay? In green, if you're feeling this, you're feeling good, you're rested, you're ready to work, you're ready to support others. You would say that you're healthy, excuse me, that you feel safe and connected. People in green are capable and confident. And this is the optimal color. You're at your best. You would say that you're in control. You're motivated. You're having fun. You're calm and steady. Mentally, spiritually, physically, all of the aspects of your being feel well. It also means that at work, you're being efficient, you're behaving ethically, legally, you're practicing within your own scope. So this is green, okay? So now we're gonna move over. The next color is yellow. We call yellow reacting. If you're in yellow, you're beginning to feel the stress energy. You're drained. You would say that you're irritable, anxious. You have this feeling of being low, of feeling down. You're definitely not having fun. You may be starting to have difficulty sleeping, not focusing. There's definitely beginning to be a start and a loss of motivation to go to work and to do your work. And those feelings might have been triggered by anything. And remember, I'm wanting you to assess yourself right now. So think about at this moment where you would put yourself. Okay, we've had green and yellow, and the next stress color is orange. Now in orange, the strain and the drain of everything is really starting to take its toll. You would say that you feel really out of control if you're in orange. You're distressed, you may feel hurt, you may be experiencing symptoms of depression, panic, you might have feelings of guilt or shame or even blame. And so orange is really the injured color. There's been excessive wear and tear constantly. Maybe you've experienced a loss, a physical loss of maybe a job, or maybe you lost a person. There may be some inner conflicts going on, moral distress about your job. So this is orange, and you can see that from box to box, the stress is getting a little heavier. And then the last phase of our stress continuum is red. And this is really where you're ill. So there's not much more you can handle. We call this the box that's clinically symptomatic. So you're impaired and not able to really do your job, not able to socialize, and you're worsening. You can feel that you're disordered, and the feelings are very strong. So there might be severe distress, feelings of hopelessness. So that's red. And I'm going to ask you to think about it again, and I'm going to ask you, where did you find yourself just now in the stress continuum? And maybe Tyler, since you're on the line, maybe I'll invite you into some vulnerability. What color did you identify with that you could share with us today?
You know, right now, I would say that I am probably in the yellow category, reacting. Um, I can identify I've had some difficulty sleeping lately. Definitely tell I've been carrying some more tension in my muscles, and I would plant myself solidly there. And I guess my question would be, are there any signs or things to be aware of that I may be moving more toward that orange or red area, that I can try to identify that and maybe be proactive in some self-care techniques or options?
That is a great question. And yes, that's why we call it a continuum. We can move very quickly between the continuum, and we can go back and forth. I've heard it described like a dance. You might take a step forward, you might take 2 steps back. You could feel like you're saying you're yellow today, but you could be orange the next. And so one of the things that can bring a person back into a less severe zone of stress is early awareness, and then an appropriate response to that awareness. So you may ask me, well, early awareness of what? And I like to call these red flags. And this is what the next screen that we're going to share with you. So let's say that today you're yellow and you're feeling all right, but you can tell that some things aren't, quite well. If you know these signs and symptoms, that you may be moving deeper into the danger zone of what we call burnout or compassion fatigue, you might be able to avoid it. So here are some that we're going to mention. Exhaustion and sleep changes. This can be a key indicator that you're moving further and further down, and it might just snap you out and wake you up and say, hey, this isn't normal. What can I do to mitigate this? And especially if your disturbance in your sleep isn't just one night, but for a prolonged amount of time, that should be a red flag for you. Increased use of alcohol or drugs. And I'm not talking about if you usually have a glass of wine at the end of the day and that helps you relax. I want you to pay attention of, is the glass or 2 or 3 of wine at the end of the day the only way that you're able to cope? That might be a red flag. And also when you begin to notice that those things are becoming secretive, and I'm not just talking about drugs or alcohol, this could be sex or food or spending money. It could even be overworking, right? When we feel like we can't leave our work environment or go home. Another red flag is dread working with certain types of clients. So you tend to start avoiding these type of people or these type of people. That can also go the other way. You can become obsessed with having this compulsive desire to only work with X type of person, that's a red flag. One of the most important that is a diminished sense of enjoyment in your career. You're just not happy doing it anymore, and you aren't motivated anymore. I think a lot of us have experienced some type of that during this COVID pandemic. Some of that's normal, but if that's happening continuously, that should be a red flag, and you should become aware of that and step back and say, wow, what can I do to mitigate that? Here's some others. For example, isolation. This is a big problem right now in our age of social distancing. Even in this meeting that Tyler and I are having, while it's good that you guys might be able to watch us from your offices or homes, it really takes away from our ability to physically see others. And even unknowingly, we always express our emotions and receive emotions when we are face to face. So right now I'm not wearing a mask, and you're seeing my mouth as I smile. That affects us in a positive way. When we can't see people face to face, there's really an effect that our emotions can become bottled up. So that could be a red flag. Impaired ability to make decisions. So I'll just share that, with school coming back and what do we do with our kids, I really felt that I was impaired in my decision to decide, do I send my kids to school or do I keep them home? And some of that inability to even make a choice should be a sign of us that there's a lot of stress in our lives, and what can we do to address those? So those are some of the red flags, and there may be others that we could add later on.
Thanks, Raquel. So I'm wondering, as we look at these signs and symptoms to be aware of, I'm sure that we're going to have to think about maybe making some adaptations in the way that we work and the way that we interact. For example, some adaptations that I've made personally, I've cut my social media consumption way down, my news consumption. I used to be the guy who was listening to NPR on the way to work every single morning, and now I've changed that to an audiobook because it was good for my sanity. I'm just wondering, are there any adaptations or changes that you've made or you can encourage other people to think of making in our lives as we go through this difficult time and just try to hold on to our passion as caregivers and also our sanity, maybe?
Absolutely, and I'll invite you to unshare your screen so again we can see your face and relate to each other in that way. But I like where you're pivoting our conversation, because it's enough for us to talk about stress and to talk about these signs and symptoms, but how do we fix it, right? How do we cope? How do we move on? And I agree with you that, we need to adapt, because the reality is the absence of stress should not be our goal, because we all know that's not possible. Can any of us say that we're going to stop all the stress in our lives? That's not a realistic goal. And I like what you said about adapting. So some of the things that we can do is, again, choose to think of things in a different way. We could physically change some things. So here in my office, my computer and my desk used to be against the wall, and I would stare at the wall and the screen all day, but I happened to have an office with a window, and I was feeling really down and really low. And again, in the stress continuum and with the red flags, thought, I need to make a change. Something's not working. And I literally one day dragged my desk across the office, and now I can see out the window and there's a little bit more brightness. And that's a very small physical adaptation that I was able to do that lifts my spirit just a little bit. We don't have to change the world. Adapt in the littlest ways possible to make your quality of work and your quality of life better. Another thing that I think that we can do is, beside adapting, is that we are daily aware of ourselves. So with the stress continuum that we talked about, and I just asked you guys to consider where you are, but to do that daily. The fact that maybe you have logged on to watch this already elevates you as a person who is caring about your mental health. So kudos to you for watching this. But could you daily ask yourself, how stressed am I right now? There's also a lot of different things online that you could download an app that tracks your stress. But being aware of how stressed we are daily is very important, because unless we realize that these red flags are coming up and these things are happening to us, we're not going to start mitigating it. And so awareness, adaptability, and adaptability really has to do with mitigating those things that are contributing to our stress and adding activities and thoughts that are going to increase our supportive well-being. So the last thing I want to mention, because we know that this isn't prescriptive, right? Tyler, I can't say to you, do X, Y, and Z and you're going to be well. We wish that that was the case. But I do want to give you something that you can work on, perhaps at home. And one of the things that really helps me is seeing a coping mechanism of having self-compassion. So in my faith tradition, someone comes to Jesus and says, Jesus, what is the most important message for me right now? And Jesus says to him, love God, heart, mind, and soul, and then love your neighbor as yourself. And I think that for us in the work that we do, we need to love ourselves, and we need to have compassion for ourselves. There's a big self-care movement going on, and there's a lot you can find on the internet. But to me, the images that I find online of self-care sometimes has someone lying in a meadow, or couples getting a pedicure, people at a beach, and that's good. I hope that you can take a vacation and do those things, but that's not always the reality that we can have. And so what are the self-care things that we individually can do that will get us out of the rut? Because what used to get us out of the rut before COVID won't necessarily work anymore. The world has changed, and we need to change with it. So attached to the link of this video are going to be some attachments, right? And those are going to be some resources. One of them is a sheet that's called The Balancing of Our Whole Lives in Holy Ways. And this really just goes along with making a self-care plan for yourself. Because unless we know ourselves really well, we won't know what will work for us. So some of the questions that I can share are, who are your colleagues? And how are you nurturing those relationships? And how can they help you? Another one is, how do you know you have a soul? And what alerts you to the fact that you might be losing that aliveness in your soul? And there's others. What are you reading that's not required right now, but that stimulates your thinking? Another resource that I really liked that's attached is called an emergency self-care worksheet. And this one has to do with making lists. So make a list of those things that you really enjoy doing when you feel down. So maybe that might be watching Netflix with your family, or whatever it may be. Another list is, who do you know you can contact when you need to talk? And then who do you need to avoid? And what things do you need to avoid when you feel down? And the point of these lists is for you to have a starting point to know what to do and what to do, who to call, and what to, be like when you're starting to feel down. There's other resources that we've attached as well. But remember that we can be doing really well, and then something happens just like that, and we can move from green to red within a day. And so be aware, adapt as much as you can, and then really have some compassion for your own self. Create a self-care plan that will lead to better well-being for yourself.
Fantastic. Well, Raquel, I want to thank you so much for taking the time to share your expertise with everyone who's tuned in today, and to our viewers. I just want to remind you all that your chaplains are here for you in whatever facility you may serve in. There are local chaplains who are more than happy and willing and able to visit with you if you need somebody to talk to in a confidential way. We are here to serve you. Um, Thank you so much for your time today. I hope you have a wonderful afternoon, and go in peace, knowing that you're loved, and be blessed.
Thank you, everyone.